The Senate Committee on Health, Education, Labor, and Pensions will please come to order. Senator Murray and I will each have an opening statement, and then we'll introduce the witnesses. After the witnesses' testimony, senators will each have 5 minutes of questions. It wasn't long ago when I was a boy that I remember the terror in the hearts of parents that their children might contract polio. I had classmates who lived in iron lungs. The Majority Leader of the United States Senate, Mitch McConnell, contracted polio when he was very young. He has a poignant story about his mother didn't know what to do, but she took him to Warm Springs because that's where President Roosevelt went. And for a long period of time, when he was 2 and 3 years old, she massaged his legs several hours a day, which is hard to imagine if you remember toddlers. And that's why he's able to walk today. Thousands of others are not so lucky. Following the introduction of a vaccine in 1955, polio was eliminated in the United States in 1979, and since then, from every country in the world except 3. Polio is just one of the diseases we have eradicated in the United States thanks to vaccine. Before the vaccine for measles was developed, up to 4 million Americans each year contracted the highly contagious airborne virus. In 2000, the Centers for Disease Control and Prevention, CDC, declared measles eliminated from the United States. And in 1980, smallpox was declared eradicated from the world by the CDC and the World Health Organization. These stories of polio and measles and smallpox are a remarkable demonstration of what modern medicine can accomplish in the lives of millions of people in our country and in the world. 4 years ago, this committee held a hearing on vaccines. That was following the 2014 outbreak of measles, the worst outbreak since the disease was declared eliminated in 2000. And even though 91% of Americans had been vaccinated for measles in 2017, according to the CDC, we continue to see outbreaks of this preventable disease because there are pockets in the United States that have low vaccination rates. Last year, there were 372 cases of measles, the second highest number since 2000. So far this year, there have been 159 cases reported and outbreaks confirmed in Washington State, New York, Texas, and Illinois. We know some Americans are hesitant about vaccines. So today I want to stress the importance of vaccines. Not only has the Food and Drug Administration found them to be safe, but vaccines save lives. Vaccines have been so successful that until recently, Americans have lived without fear of getting measles, polio, or rubella. We've made significant strides in improving vaccination rates. In 2009, about 44% of Americans had received vaccines for 7 preventable diseases, all of which I'll now try to pronounce: diphtheria, tetanus, pertussis, polio, measles, mumps and rubella, Haemophilus, influenza type B, hepatitis B, chickenpox, and pneumococcal, according to the CDC. Today, over 70% of Americans are vaccinated against all 7 of these diseases. Vaccines protect not only those who've been vaccinated, but the larger community. This is called herd immunity. There are some young people who cannot be vaccinated. They're too young, or they have a weak immune system because of a genetic disorder, or they're taking medicine that compromises their immune system, like cancer treatment. Vaccines protect those who cannot be vaccinated by preventing the spread of disease. However, low immunization rates can destroy a community's herd immunity. While the overall vaccination rate nationwide is high enough to create this herd immunity, certain areas, the pockets of the country where vaccination rates are low, are vulnerable to outbreaks. There's a lot of misleading and incorrect information about vaccines that circulates online throughout social media. Here's what I'd like for parents in Tennessee to know, parents in Washington, parents in Texas, everywhere in the country. Vaccines are approved by the Food and Drug Administration. They meet the Food and Drug Administration's gold standard of safety. The Advisory Committee on Immunization Practices makes recommendations on the use of vaccines in our country and annual child and adult vaccine schedules. This advisory committee is made up of medical doctors and public health professionals from medical schools, hospitals, and professional medical organizations from around the country. They're among the best our country has to offer. They have dedicated their lives to helping others. These recommendations are reviewed and approved by the CDC director and are available on the CDC website. There's nothing secret about any of this science, and countless studies have shown that vaccines are safe. Internet fraudsters who claim that vaccines are not safe are preying on the unfounded fears and daily struggles of parents, and they're creating a public health hazard that is entirely preventable. It's important for those who have questions about vaccines, especially parents, to speak with a reputable health provider. As with many topics, just because you found it on the internet doesn't mean that it's true. The science is sound. Vaccines save lives, the lives of those who receive vaccines, and the lives of those who are too young or vulnerable to be immunized. Before I turn this over to Senator Murray, I want to add that the National Child Vaccine Injury Act of 1986 required the Department of Health and Human Services to submit a report to Congress within 2 years after the legislation was signed into law. The HELP Committee has received 2 reports from the department submitted to Congress May 4, 1988 and July 21, 1989. I ask consent that the reports be submitted to the committee record so they can be more accessible to the public. Senator Murray.
Thank you.